Okay, practicing medicine is stressful. Everybody knows that, and you know why. A lot of responsibility. People are always very emotional and so on and so forth. There's other things happening besides me and the patient. There's healthcare reform, and you can see all the issues that that brings up. There's an information explosion. Yeah, there are some of us in the room, everybody in this room, because you're at this meeting, you want to learn a lot, but it's work to keep up with the journals and go to meetings and pay attention. And there's a lot of the financial aspects and the other administrative aspects of the practice that collectively really do put us as practicing physicians on the front line in a very difficult spot. What is burnout? Well, there's a well-described syndrome of burnout. The main features are emotional exhaustion, depersonalization, and a decreased sense of personal accomplishment. These are the questions that are used to assess somebody's degree of burnout, and you could kind of look through them later on and answer it yourself. It is estimated in the United States about a third of people or adult people are burned out. However, about half of physicians are burned out. And by specialty, this is data from a Mayo Clinic study in 2014. Urology led the pack. 64% of the urologists they surveyed were burned out. Just released literally 2 days ago a Medscape survey. Again, urologists were at the top of the list with 54% considered to be burnout, and you could see the other specialties there. This paper got published last month. This is a survey from the AUA, and they found, again, it probably depended on which urologist answered the questions here, and I'll show you why. Only about 40% of urologists met the criteria for burnout, 17% very high on emotional exhaustion and so forth. And these are the key things. The younger you are, the more likely you are to be burned out. Your years of practice, again, the younger ones are more likely to be burned out. Practice-wise, pediatrics and oncology were relatively favorable compared to general and some other areas. Practice setting, you can see that the big winner there was other institutional, and patient visits per week. Obviously, the more you work, the more you're going to be burned out. That's from the AUA. The correlation between workout and hours. Now, I'm not going to talk about this because I think you have some millennial talks coming up. First of all, the millennials characterize themselves. This is an awesome paper that I found. They're all burned out, basically. And I think we're talking about millennials later on. But this appeared in European Urology just this month, and this is a survey of French urology residents. Only 9% had no symptoms of burnout. Only 9%. Turn that around, 91% of them are burned out. Can you imagine that? And by the way, what do they blame that on? Parenting. That's you got to see that paper on millennials and burnout. Okay, what are the consequences of surgeon burnout? Well, it affects physicians, it affects patients, it affects your healthcare system, and these things sort of speak for themselves in terms of how they affect the surgeon. It associated obviously with depression and suicidal ideation, affects the quality of care. 9% of surgeons reported a major medical error in the last 3 months. Burnout was associated with that. At the organizational level, you know, surgeons may sometimes behave badly, but burned out surgeons behave worse. That has an effect on their coworkers. They themselves are less productive. They're more apt to make errors, and that drives up litigation costs and malpractice costs. So how do you address burnout? This is the $100 question, and I think we have to do it at 3 levels: at the individual, at the organizational, and we even have to do it nationally. There's got to be some recognition that this is a real problem and probably a bigger problem in the upcoming years. First idea, decrease the burdens of documentation, clarify and make easier the use of non-physician extenders for many of these tasks, change the documentation requirements. NIH should fund some research looking at what the issues are and how to improve work-life health care. CMS has come up with an idea to create an Office of Clinician Engagement that may help physicians who feel like they're getting burned out. Insurers should put limitations on unnecessary requirements and justifications. Obviously, we should simplify the billing and coding things. The boards and the licensing boards should simplify maintenance and certification requirements. It's pretty stressful for people to go through every 10 years to have to take tests and so forth. And maybe we should do a better job down here looking at the mental health of people renewing their license. Institutions should keep better metrics on their people, and there are models out there that predict when a surgeon or a physician is getting in trouble, but you have to record the metrics to put them in the model to then identify who's the individual at risk. Healthcare systems should try to consider totally new practice models that don't result where the MD, the doctor, is the person responsible for everything. The buck stops with the doctor right now. And one of the tests, and there was a study proving this, was that scribes, for what it's worth, and I use a scribe, seem to help quite a bit in preventing and mitigating burnout. Healthcare systems should embrace process improvement. Now, some of this is mumbo jumbo. I do spend a lot of time on patient safety and quality improvement. We talk about the same things all the time. Hard to get surgeons to buy into that, unfortunately. They should allocate dedicated time for administration work and pay them for it, or compensate for it. Most of the models only compensate you for work RVUs. The supervisors or the leaders of these healthcare systems should get off their throne and realize that we're not working for them, even though we actually are, or at least make us feel like we're not, and actually try to help us do a better job. Recovery from burnout is possible, but prevention is better. There are wellness programs that should be started at the medical school level, through residency, practicing, and even in retirement. AMA has these 7 guidelines on how to prevent burnout in your practice. And this is the tracking tool I was telling you about, that if you survey your practitioners often enough, you can see where they stand and identify the potential problems and intervene before it gets out of hand.